We'd like to thank you for joining us today. My name is Bill Baker with Firestorm, and we have a very special webinar and a very timely webinar for you today. We've got the blue ribbon panel of presenters and speakers, and we are pleased that you're able to join us. We'd like to also invite you to become our friend on Facebook at Firestorm Solutions. You can follow us on Twitter at Firestorm Soul. We are following and monitoring the hashtag today, and that hashtag is Crisis Coach. Firestorm transforms crisis into value and empowers you to manage risks and crises. Firestorm expertise is crisis management, critical decision support, crisis communication, crisis public relations, and consequence management. Keep in mind that this presentation is not complete without the accompanying oral comments and discussion. The work product also must be considered in conjunction with your organization's personal counsel. Additionally, keep in mind that this webinar should not be interpreted as legal advice or legal opinion. We're so pleased to have RenWeb as our co-sponsor of this Crisis Coach webinar series. And the subject today is, why should your school care about communicable illness today? We invite you also to go to firestorm.com to watch past webinars. You can watch the recordings there and register for future webinars. The Crisis Coach webinar series is underwritten by the RenWeb people. We are pleased to have them as a partner in this development in this process to provide these webinars free to their members and their friends. I'd like to introduce the presenters. We have 4 of them today. Jim Satterfield is the President, Chief Operating Officer, and co-founder of Firestorm. He has extensive experience in the insurance industry. He also is an excellent speaker. He has been a presenter on many of these webinars and has been very well received. Steve Cunnion is an internationally recognized infectious disease specialist. Dr. Cunnion is a retired Navy medical officer, and he was credited with alerting the Western medical world to the emergence of SARS. He serves as the medical director of the Center for Health Policy and Preparedness. Dr. Donahue is a recognized expert in health policy, operations, and preparedness. He's a retired Army Medical Service Corps officer. And Dr. Donahue is a board member of the American Academy of Disaster Medicine and the American Board of Disaster Medicine. He's the executive director of the Center for Health Policy and Preparedness. Both Don and Steve hold multiple academic appointments at the graduate level, and they're the founding partners of the Diogenic Group, a Washington, D.C. healthcare professional services group. Susie Laughlin is an attorney. She's also the Executive Vice President, the Chief Administrative Officer, and a co-founder of Firestorm. Susie is very well known for her work with communicable illness, workplace violence, and other things. Her background is HR and insurance and legal.
Bill, thank you.
Jim,
for the introduction.
over to you. Thank you.
Thanks, Bill, and for your introductions and all the information. We've got a lot to cover today, and yes, the slide deck will be available later after the webinar, so as you're taking notes and looking at information, there'll be more than you can physically write down in every area. To the right of your screen is a toolbar. In that area, if you have questions, please type those questions there. We will not be able to address every question today during the live webinar, but we're going to reach out to everyone who attends today to get you the answers to your questions as they occur. We always start our webinars with an update of what's been going on around us, and today we really want to focus on communicable illness, and we've been seeing the Ebola virus in the news. We've been seeing the Enterovirus 68 and the paralysis potential that's associated with that. We've seen tuberculosis in El Paso and an emergency area. We see other illnesses around the country circulating through, and we're going to address them. So our focus is communicable illness, and as we think about that, I've known Dr. Cunnion and Dr. Donahue for a number of years. They've been very active on our expert council and certainly provide some insights. So I think we ought to start with an update of the Ebola, and then the D68, and then talk about a couple of other things. So Steve, Don, which one of you can share some thoughts with us about Ebola?
Okay, this is Dr. Cunnion. We can start off by talking about just a little bit of history here. Ebola's been around for about 40 years. Up until now, it's usually been contained in the cities that it started in, and with good infectious disease control, it can be stopped in the hospital. And I think we're seeing that down in Texas now. Ebola is not spread by any magical means. It's spread by normal blood and body fluid contamination. So by the proper precautions and washing hands and watching out about any abrasions you have on your skin or touching your eyes or mucous membranes, you can pretty much avoid contact with the Ebola virus. Right now, we've seen actually the disease stop in Nigeria, and it looks like there's some decreases in certain other towns in the Western Africa area. So hopefully, no matter how much gloom the media has been reporting, I think this will be controlled in both Europe and the United States without any problem.
Don, can you add to that description? And it sounds like I lost Don there. Steve, are you still there?
Yep. Mm-hmm.
Okay. All right, but I was afraid it was me at this point. So as we look at this, obviously we can screen for these, and when I look at the symptoms here, there are other things that might cause those symptoms, isn't there?
Well, that's the problem with Ebola. It looks like most viral diseases, including influenza, the common cold, Enterovirus, like 68, they all start out with fevers, headaches, muscles aches and pains, soreness, tendency to vomit. And
the interesting thing on the Ebola is it is not airborne. This is a contact illness. Am I correct?
Yes, not airborne in the way we talk about sneezing. Not saying that you couldn't get a splash if somebody splashes blood on you or fluid on you, that you couldn't get it that way. I mean, that's airborne, but it's not airborne in the classic sense of coughing and sneezing.
The Enterovirus D68, in the slide that's up on that now, says it's been around since 1962. Why are we suddenly now aware of it?
Well, we first recognized it existed in '62. We probably was there a long time before that. We just didn't have a test for it. There's many viruses that we still don't, that have only been identified in the lab and are not even looked for in the clinical setting. So that's a real problem when you talk about a new virus. Most viruses are new. We just happen to have a test, and we start testing for them. Matter of fact, now, if you look at all the states that have it, which are virtually all the states in the Union, at least 47 out of the 50, the enterovirus is there. And when you see that kind of blanket, you know there's a heck of a lot more than the 600 cases that CDC is talking about. It's just that the only ones that are being tested are the hospitalized kids in big trouble with a respiratory, because they usually have associated asthma.
Well, you said something very important there, and I want to go back and make sure that I understand it. We see, you know, the 664 cases or 670 cases. Your feeling is that there are many times that number? Or could there be 6,000 cases, 600,000, or even
I would probably project as a million or more cases. It's just that they're so minor. Either you're almost asymptomatic or you have cold symptoms.
So in all likelihood, we have hundreds of schools on the phone today spread across the country. It'd be your opinion that they could likely have the Enterovirus 68 in their school today. Is that a reasonable statement?
Yes, I would say it's probably 80-85%, maybe 9% chances that's happening right now. They might have already gone through an epidemic in their schools and didn't even know about it.
We did an informal survey, or I did an informal survey before our webinar, where I asked parents, if you had an 8-year-old child and there was the Enterovirus 68 in your school, would you allow your child to go to school tomorrow? And 100% of the couple of dozen people that I surveyed said, no, I wouldn't allow my child to go to school. And I think that's an element that we all want to think about and focus on today in our conversation. Influenza, is that something I should still be thinking about?
Well, I mean, if you look at the graph up there right now, you can see that so far this year we've had 108 deaths, and only 4 contributed to 68. So flu is a much bigger risk factor, and we certainly don't keep a lot of our kids home from school just because somebody else has the flu in that school.
And when you talk about the flu season, it's right here on us, isn't it? Coming up soon?
It's coming, yep. Exactly. We can't say when it's going to start. Sometimes it starts in October. Sometimes it starts in November. But the enterovirus starts earlier than that. It usually starts in September, around the beginning of the school year.
So that was a leading indicator. Now we are coming up in the next few weeks, round numbers, that the flu season will start, and that will make the need for communicable illness planning even greater than it is today. Are there other things that we should think about?
Of course, we can see infectious diseases that were controlled up to a point popping out in schools now because so many parents have opted out of their standard vaccinations. We see this in grade schools, we see this in high schools, and we see it in universities. The measles, mumps, rubella outbreaks that we should not see.
And so that's the urgency here, to have a communicable illness plan, because we don't want to design a plan for one single illness. It could be any of these, and the good news is the steps that we take would help us in all of those areas. The survey that shows the measles outbreaks that have just occurred so far this year, 592 cases in 18 outbreaks. All of these are preventable, and that's the reason to have a communicable illness plan within your school. We did a survey question for everyone who signed up today for our webinar, and here are the results. Of the people that signed up, 26 said that they were concerned about their school, their facility. 65% felt that they could be doing more, and only 9% felt that they were prepared. We had well over 250,000 students represented from the schools that are attending today's webinar. So if you think about that, that means that there, by the declaration of the schools that are here, over 200,000 of those students are at risk or potentially at risk around it. So when we think about simplifying preparedness, and communicable illness is a part of that, as we've talked about in other webinars, we think back about what we need to do. Now, I assume that most of the schools that are on the phone today have a little bit better AV system than the Gargle Daily blackboard that's listed up there, and have a slightly different set of footwear in their school associated with it. But those signs and symptoms really haven't changed over the years. And when we think about communicable illness, there are 3 things that must be present. First, a highly virulent organism. There has to be a lack of human immunity, and it has to be easily transmitted from one to another. That's what we're thinking about when we think about communicable illness and how it becomes so very important. Now, transmission becomes a series of direct areas. There's the direct, where you come into contact. There's the indirect, where someone has coughed on something and transferred it over to another. There could be the droplet that would occur, or finally it's airborne. When we're dealing with Ebola, we're dealing with the contact and the droplet, not the airborne. If we're dealing with other things, it could well become an airborne illness, as we've been concerned about in the past with things like the avian flu and the swine flu, as we go into those areas.
Jim, when you talk about the common cold, that's mostly transmitted by hand. At what we call hand-to-mouth transmission, where influenza is a combination of both hand and mouth and aerosol by sneezing and coughing.
So there's a lot of those modes, and as we talk about our plans, this type of information will help you as you're designing your cleaning policies and your other distancing aspects that would come together. So who's at risk in the flu? And you see the CDC's advisory that has come out, and I highlighted there in the yellow in the center, persons of ages between 6 months through 24 years of age. A lot of times we think about the elderly in those areas. But if you look at the quote from the Admiral, children and young adults, pregnant women, people with chronic health conditions like asthma, diabetes, heart disease, neurologic problems, and immune suppression issues, all are going to be directly affected. So as we discuss it, there's a lot of areas here. But I think the key point we wanted to share today, that having a plan makes a difference. And Susie, I know that you had some thoughts about this. And do you want to kind of share that with us? And then I want to ask Don and Steve about the graph in the bottom right. So Susie, over to you. Any observations around planning?
Well, I think, Jim, through planning, that's the best way to address fear. I think fear stems from people feeling like they just really don't know what to do. So when we talk about, Steve mentioned things like transmission through hands and touching. And I think we all have the ability to implement policies within our schools and all of the activities that go on there, everything from handshaking to certain contact. And I think that, teaching everyone, everyone in the school community, whether it's students, faculty, employees, visitors. I mean, visitors, frankly, are one of your biggest exposures because they don't know the rules. So you might have a visiting school coming for sports, or you may have a production of some kind that you invite the public. So having protocols in place and doing your best to understand what are the vulnerabilities you face when you really can't control the environment, and then try to put into practice some of these strategies to address them, goes a long way.
So Steve, or Don, and Don had obviously some communication difficulties. This chart shows two different blue configurations. Can one of you speak to that?
Sure. Don, you on? No, I guess he's not. Okay. Well, the top peak is what you consider a normal disease outbreak curve. We call an epi curve. And the bottom one represents what would happen if you have a good preventive program going. First of all, it starts later than the normal outbreak because you have preventive measures in place. But nothing's 100%. So you will start getting some disease. But with your preventive practices in place, you definitely will reduce the amount of illness that you'd have if you didn't do anything.
If we were mapping this out, you would say then that the bottom curve in the representation here, and obviously results would vary, would be a 90% decrease or more in result of the impact. So you're reducing the frequency and severity of it because you have a plan in place.
Well,
if you're looking for, sorry, go ahead.
I mean, as you said, it depends on the disease. I mean, if you have one that you stopped with immunization, you definitely see something like this.
And so that's part of the reason why we're holding the webinar today and providing the information. When we think about communicable illness, there's a lot of different things out there that it could be, and you see some of those coming up on your screen. By the way, dengue fever is going to be one that we'll continue to hear more about, but the MRSA staph infection. But all of these have a potential to create a negative impact. Now, tracking what's going on around the country, you're going to find lots of reports, and I would recommend the CDC site and others as they're tracking nationally, and you can see some slide shots from earlier in the year. And the takeaway that I want you to have from this slide is that it's what's going on where you are. Is it in your area? And as you see in that activity slide up there, is it a high? If you're in that area, like the state of Texas in this drawing, that would be an area I'd be more concerned about. So we're going to break this down and look at critical decisions that you have to make as you're building a communicable illness plan within your school. You want to review your existing policies and procedures and benefits, and it's because what we pay and how we pay people and how the decisions are made within our organization become extremely important. Develop our plans and our procedures and arrange to make sure that we have the supplies that we need, and then finally training and testing of your plans. Sitting down with your school, as we talked about in workplace violence or in other areas, saying what would we do if these things would start to occur. Now, as you start to look at an outline of what's needed in that planning, you need a roadmap. You've got to get buy-in from your board, and we're going to share you some more information about getting the board at your school involved in it and making sure your planning teams assessing it, the strategies, how you would carry forward, and you'll see there on item 5, we really want to call this a communicable illness plan as opposed to a pandemic. We're not in a pandemic at this moment. It is an issue that we want to continually think about. There have been reports of the swine flu returning again this year at pandemic levels, but right now there are illnesses of a wide variety that we've seen and already in the discussion that Steve has shared with us that we want to talk. And look at item 10. This is a continuous process. We talk many, many times in our preparedness webinars about this being a continuous improvement process, and that's what we're looking to share with you. So as you start out, they're checklists, and that's a way to start figuring out what are the issues that you're going to have to deal with. And they cover a wide range of topics and areas, and so there's a lot of involvement in doing this planning. Of all of the planning you're going to do, communicable illness planning requires the most detail with the most people in your process, and it becomes a critical element associated with it. Now, we talked that we would... Yes, Susie, please.
Can I jump in? If you go back on that slide for one moment, I'd just also like to address in particular number 2, communications. You know, we've responded to many communicable illness outbreaks within some of our client organizations like summer camps. And I can tell you that there's a period of time when you're not really sure what the outbreak may be. So, for example, meningitis. A child could present with symptoms. Is it in fact meningitis? Is it viral? Is it bacterial? Is it something communicable? There are even forms of viral that aren't communicable. But the most important challenge you face is that in that period when it's unknown what is going on, people are panicking. And that the panic level rises significantly in the last few years as a result of social media. In the past, you know, it was something you could contain fairly well within your organization, your school, your community. Now it gets perpetuated. The dialogue on social media and the fear factor just escalates. So sometimes even without the actual disease panning out, it might turn out to be something fairly benign. If you're not prepared with how to communicate to your school community, parents, students, faculty, visitors, during that period of time while you are waiting for results, that can almost have the same impact as if the disease was one of the worst ones you could encounter. So I can't emphasize enough the importance of having a communications plan with pre-scripted letters, messages, Facebook posts, whatever it is you're going to need to deal with.
Thanks, Susie. That was great.
I'd like to add one of my favorite comments, and I'm an infectious disease epidemiologist, but fear is the most infectious disease.
And Steve,
Exactly.
didn't your daughter call you about the D68?
Yeah, I was not actually paying much attention to D68 until my daughter called me. Of course, I have 3 grandchildren by her, and she was starting to panic, and I had to calm her down. So I've been have a personal part of this also.
Well, I think, and I think what's important about that, Steve, I mean, I think, and for everyone, you know, when you think about this enterovirus, as Steve said, it's been around since the 60s, and it occurs each year. And I think were it not for these cases that we're seeing with the paralysis, and by the way, Steve, maybe you can comment on this, but my understanding is that they haven't directly correlated the paralysis yet with the D68, but the media has created such a frenzy and turmoil that people are panicking regarding D68. So maybe you could address that, Steve.
Sure. With the California outbreak 2 years ago, of the kids that got paralysis, half of them showed they had been exposed to D68. But now, as more and more evidence comes in, it just happens that D68 is going around right now, and it doesn't seem to be associated with the paralysis. So we have something else out there that we're not able to track right now that's causing this paralysis, and they're working hard to figure out what it is.
And that means that you need to have plan even more. So, hey, Don made it back with his voice. Don,
yeah,
please say.
For some reason, my line went totally off. I wanted to add briefly to what Susie said. The communication also needs to be proactive, because if you're not ahead of the curve and you don't provide good information with social media and everything else, people will find their own answers, and they're not necessarily correct.
And what we want to do then, I think we're all building a case that planning needs to occur. And up on the screen now are some board resolutions that we think your board should consider, and authorizing the school leadership to put these. When we look at these types of communicable illnesses, Firestorm breaks this down into imminent, guarded, elevated, fear. And we'll share with you some insights of what we look at if it was a pandemic, how those stages come together. But obviously, as you move to that severe level, you increase the level of actions and steps that you must to handle that. And as you look at it, that monitoring them becomes extremely important. There's a lot of rumor. There's a lot of innuendo. There's a lot of fear out there and panic, and that's driven by the internet and social media. And as we've talked about it many times with you, you need to be monitoring the social media risk. What are people saying about your school and what's going on there, and creating your own intelligence network. The government authorities and giving information, non-government triggers, and we'll even share other triggers. But as you think about it, it becomes extremely important to be aware of what's going on where you are. The fact that there's an outbreak in LA, if you're in Columbia, South Carolina, those are two different issues, and we want to be concerned about what's going on where you are. You'll see each week there'll be reports by county of what's going on. This is an old graph that was up, but every state has posted within their areas. Departments of Health provide that information to look at locally. This shows the firestorm phases shown into that guarded, elevated, and severe, compared with the flu phase of a pandemic that lists all of those. Different steps are included at every step along the way. And as you see, it elevates up to the point where the school is at high risk, and you will have to look at different ways to be able to sustain learning at that point. So the planning means that you have to have policies for your staff, for your students, and looking into each one of these areas. And these are just sample ones that would need to come to mind and be able to spend some time in starting to think about establishing these now before the event actually occurs. Because obviously, if on the fly, you're not going to be able to establish a remote learning policy. How you're going to clean, you have the supplies and the training. We've seen a union in New York even upset about that. Go ahead.
This occurs right high school real close to me, less than 5 miles away. Started panicking and used industrial strength disinfectant on their football uniforms, and the whole team came down with blisters from using the wrong agent.
It's the law of unintended consequences. They thought they were doing the right thing, used the wrong thing to solve that problem, and that's why it's so important to identify exactly what goes into a cleaning policy and hygiene and other elements associated with it. And we're going to share some other insights in just a moment. Obviously, getting your supplies. We've seen in the past that there's been a shortage of N95 masks or latex gloves or other areas. How many do you need? Where are they located? How do you maintain and control them? And Susie talked a lot about this communication and the communications guidelines. Building and maintaining and restoring trust. It's easy to lose trust. If you're not keeping people informed, you're going to lose credibility. It will hurt your school over the long haul. And so making sure that you have these things designed in advance is a significant difference. You want to have sample letters already prepared now. What are your message maps telling you about what the messages need to be as it moves from imminent to guarded to elevated to severe, and how your instructions change and share within those areas. Policies and dealing with issues that would impact your employees. It's not only the policies around absenteeism. Look at the travel line further down. When should you cancel travel, field trips, or sporting events? I'm not sure in the middle of an outbreak like that is being discussed with D68 that now's the time for the wrestling tournament, or maybe it is. We've just heard Steve describe the football team and what was going on there. So looking at and modifying those policies, and then what are the benefits? What's going to apply to your staff and areas? And I know, Susie, you've spent probably more time than anybody else that can imagine in working with HR departments and organizations just to address these types of issues. Anything you want to share on policies or benefits at this point?
Well, look, I want to level set the discussion a little bit, because obviously what Jim is referring to now are the types of impacts that occur when we have an outbreak of some extended duration and some significant severity. So when we do pandemic planning, you know, in some industries they're required to have pandemic planning. So if you look at in financial services, you know, the Federal Reserve requires banks to do all the projections of how they'd operate their bank without 40% of their employees. But the 40% number is a realistic number were we to see a severe outbreak. So really what you have to say to yourself is, how do we operate with up to that percentage of loss of our employees, and what does it mean from a policy and benefit perspective? And, you know, academics it varies. I mean, if you're a public school, it's going to be different, the impacts, than it is the private institutions. I mean, public schools obviously have lots of union negotiated contracts, and, you know, your benefits may be spelled out, but there's still a financial consequence to paying people when they're not coming in. And, you know, do we have to do things like think about substitute teachers, and where do we get that workforce from? Or do we migrate completely to an e-learning environment? For those of you who have boarding schools, we know that's not possible. Or if it is possible, you have to think about, well, how do we keep these students safe while they're in our care, custody, and control? So there are so many tentacles to this type of planning, but literally it would require a very close look at each of your HR policies to see where you have financial impacts and exposures.
And people will be looking for money if you have to downsize, if you have to lay off. And we've seen projections of potential runs on a 401k as people are looking for money. If you're requiring people to come to work when there's a risk of these types of localized outbreaks, or even a national, in the case of a pandemic, you know, does workers' compensation insurance come into play? There are legal issues, not the least of which would be the confidentiality under HIPAA. And if suddenly someone comes forward and says your school is not doing things, is that a whistleblower statute as you're carrying along? Looking at your suppliers and contractors, Susie mentioned substitutes. How do you know that that person is not sick and coming to work and moving? If you have outside security, what's their plan, or food services, or other vendors that you're relying on in your school? You want to be aware of what their plans are as we come together. So if we wanted to summarize this, we need to develop or review the types of things that you see on your screen now. When are we going to pay people? When are we not going to pay people? Cross-training. How are we going to handle our staff in these types of areas? You'll see down in that first column, second up from the bottom, remote learning. While it's not an e-learning system, it could easily be, we're going to email home a lesson plan. We're going to do a conference call so that children can call in and at least hear a lesson review or talk about from the teacher to keep them up. Because if you lose 20 or 30% of your class, how do you manage that? How do you keep them together and working? If it becomes severe and we have to close for an extended period, does that trigger a tuition refund within your school? And if so, what are the factors and how do we deal with that, and what's our policy? You'll see the cleaning policies and the others, the social distancing. Many of our schools are on a university plan where the lower schools come on Tuesdays and Thursdays and the upper schools come on Monday, Wednesday, and Friday. How could different strategies have be worked to make a difference within those areas? Prevention, a lot of things you've already been hearing about today are listed here. And as we look at the potentials here to make a difference that we could do, keep it with a wellness policy, cleaning, hygiene. Don and Steve, if we're changing classrooms, or if we're going to lunch, or we're going out to recess, talk to me about children's hands at this moment in time.
Well, kids are always touching each other, so we know, especially with colds, that's the main mode of transportation. And as I said, with flu, you have both hands and coughing. So, oh, and by the way, D68 is not killed by, is not deactivated by alcohol-based cleansers. It has to be a non-alcohol-based cleanser, just to show that in. But hand washing should become an established part of the regime. In the military, we've done that in our training camps. We have wash setups outside before they go into the mess. We have things like that, because when we concentrate our trainees, they get stressed out, the immune system gets lowered, and they become very susceptible to a lot of viruses. So, and that costs the military a lot of money if people get set back from their illnesses. So, in the military, we're very acutely aware of what hygiene is so important to keep the student population healthy.
And we're going to revisit that. Go ahead, Don.
I was just going to say, emphasize Steve's point about making it part of the routine. In pre-K and kindergarten, we routinely, everybody in the class washes their hands prior to snack. Yet as the students grow older, we move away from that. So making that part of your daily routine and emphasizing that it applies as well to the students, not only to the students, but to the staff and faculty who might be carrying the disease and passing it amongst the students.
This is a perfect example is whooping cough, pertussis. That's actually, the carriers are the adults.
So the prevention and protecting yourself go hand in hand. And I think a lot of times we forget about it. And that second bullet here about washing your hands thoroughly for 15 to 20 seconds, and you many times see someone pass their hands underneath the spigot, and that's it. And it's a much more involved process as we're thinking of. Also, in thinking about
there's a saying in Jim. There's a saying in public health is wash your hands for as long as it takes you to sing Happy Birthday.
There you go. And I like people singing Happy Birthday to me. I think it makes a much happier washroom in those areas. Susie talked about very early on communication is critical, and looking at where people get information. And you'll notice that it's employees, it's parents, and the students in sharing that. Let everybody know what the policy is for closing and what we're going to be monitoring, looking. What's our rules for notification? How are we going to deal with absenteeism? What are the sources and where do people go to get the information? For those of you that are RenWeb customers, you've got a lot of notification opportunities that you can in fact do with your parents in planning it out. But you don't want to create these messages on the fly. You need to plan them in advance. As we move from that, monitoring and triggers. What are you looking for in your area? Now, so the World Health Organization, the Centers for Disease Control, state governments, your county health departments, local and national news, what's on your news stations. I was talking with some people the other day just outside Dallas, and it was Ebola all time on their news station as they were carrying forward. Look at internal incidents. If you start to see absenteeism picking up, if you see other types of things that are happening, those types of spikes, those are issues that to be concerned about. Also around you, if you see businesses in your area closing, if there are other school closures, if the public schools are closing and you're an independent school, is another indicator. Just like we think about snow days and winter days in many locations. Runs on banks, because if people are suddenly afraid, those ATMs won't have cash, and that might well be an indicator for you. So establishing your monitoring plans as well as the triggers. How many people have to be out before it triggers an escalation in your plan? Those are the types of decisions that you will need to make. And the triggers vary depending upon the phase. Are we in that pre-pandemic area? Are we at onset? Are we at a severity level? Are we at a guarded or an elevated? All of those are different triggers that you would be looking at to activate your plans as we go forward. And having that type of control goes hand in hand with what you would do from cleaning, from a social distancing standpoint, or even going to remote learning at each one of those elevations and moving forward. So we talked about at the very beginning as one of the steps in the area was you have to test and train and maintain your plans. We recommend that you do this at least annually. I would recommend if you could do it in the spring, winter, fall would be excellent to think through each of those areas about what would be coming through. There's a lot to evaluate and a lot to confirm, but you want to be keeping track of it. Also, keeping your plan current. Steve and Don and Susie have all shared with you today many things that are breaking in news, and this thing continues to change, and it will continue to evolve. And so as you update your plan and have it in place, it becomes extremely important. So what I'm going to do is to ask Don and Steve and Susie to share any last thoughts on this, and then we want to talk about some next steps. And my last thought is make hand washing a healthy habit. Everything your mommy taught you when you were growing up is what you need to do, and this is one simple thing that can help in every school. Don, have you got a piece of advice that you can share with everyone today?
Absolutely. In planning for this webinar, one of the things that we talked about was many years ago when HIV and AIDS first came out. And while it's certainly a serious disease and a global challenge, it isn't nearly as scary as it was felt at the time. So awareness, knowing the facts, and planning and being ahead of the game is the key. I say there's certainly cause for concern here, but there's no cause for fear.
Thank you. Steve?
Well, I'd like just to say, even if you have a plan, if you don't practice it, your plan's just going to gather dust on the shelf, and when a crisis hits, you're going to be in deep trouble.
Good. Susie?
I want to go back to the point I think I made earlier. I think the planning is critical, and as Jim said, when you do pandemic planning or communicable illness planning, it's really the most comprehensive type of planning you can do because it addresses every facet of the way you run your school. Unlike where we're doing, testing for you might have a tornado or you could have a fire or, those are obviously disruptive and potentially, life-threatening, but they usually impact a smaller group of people in a particular facility. In this case, your school will be experiencing the impacts, if it is widespread, within your school population, but also everyone around you will be experiencing the same thing. So the resources that you depend upon will be similarly stressed. And you have to be much more self-sufficient and reliant on your own people. So I can't stress the importance of this vendor dependency, understanding everything from your food sources to critical supplies that you need and planning for that. And then the last thing I want to close with, Jim, is just to reemphasize that I've seen the reputation, we in Firestorm have seen the reputation of child-based organizations devastated and some even destroyed as a result of a single case of an illness that did not get handled the right way, usually due to the way the communications were handled and the breach of trust that resulted within the community. So preparing for something like this gives you the opportunity to craft communications that will help you, yes, in an outbreak, but also in that one single case that is much more likely to occur. And I think if you look at it that way, you'll really justify why you need to do it in the grander scale.
Good.
Susie, that's great. If you want to add something else, go ahead.
Real quick add on, looking at the time. Also, it's proven in public health around the globe that schools and children are a huge conveyor of information. What you teach your students, they go home and talk over the dinner table. So it's not only watching out for your own institution, but it's truly a public health and a health communication benefit to the community.
And everybody on the call today has a mission. And I'd like to thank everyone for what you're doing for our young people and our children in providing the education and the environment to help them grow and to prosper. You've gotten a lot of information in a very short period of time today. So now what's next? How do we go from here? We're going to try to reach out to everybody individually. We've had a lot of questions typed in during the webinar, and we certainly can't address them in the last minute today, but we're going to reach out to you individually. Feel free to contact us directly at Firestorm. You can send us an email at webinars@firestorm.com or even call us. But we've come up with some steps that you might want to consider. One, we're going to try to answer everyone's question. Two, 2 weeks from today, we're going to do a 2-hour web workshop, and it's going to be a how-to to do all the detail activities that you heard the overview of today. And it will be on October the 24th at 2 p.m. There will be a charge for that workshop. We don't charge for our webinars, as you all know, but that workshop is $199, and it's a site license. That means you can put as many people into a room in your school as you would like, and they can attend the webinar, and we'll step them through and give you a detail. If subsequently to that you would like to have a communicable illness do-it-yourself toolkit, that's available at Firestorm. It's $8.95, and it includes 3 how-to-implement web workshops that will be included in that number. If you attend the 1024 workshop and would like to have the toolkit, we'll credit the $199 toward the cost of the toolkit. So we gave you a lot of information today. The main thing is we don't want there to be panic. And one case can make a significant difference in your school. Firestorm responds to crises on a regular basis. We've seen the consequences of this expanded greatly. And when you talk about children, when you talk about young people, it makes all of this significantly more important. Susie mentioned the work that Firestorm does in the camping industry, and that's a very intense period of time, and anything that happens at a children's camp has a tremendous lasting impact. Communicable illness happens. We've had children become sick. We've had children to die in these types of areas. I would encourage you to work on your communicable illness plan today. If you would like to join us, there'll be sign-up information on our website shortly. We'll send you some information about the web workshop on October the 24th. We look forward to speaking with you then. If you've got questions in the meantime, send them to us. We're going to reach back out to every school today. Thank you all. Good luck at what you do. Have a wonderful weekend. And until our next webinar, have a great day. Goodbye.